What Dr. Fisher did, I mean, he did many things in breast cancer. He showed that the extent of breast surgery had nothing to do with survival. Just so if you remove the primary tumor, whether you remove the whole breast or whether you just take out the tumor, the 20-year survival of breast cancer is the same. He also established the complete 180-degree paradigm shift in thinking that women who die of breast cancer already have metastatic disease before they ever get a mammogram. Because once you remove the tumor, it can't spread after that. And that breast cancer, for people who are going to die from it, is a systemic disease from day one. And that was a huge shift in thinking. People always thought of breast cancer as a breast problem, and it's a total body problem. And his early clinical trials made that clear. He also introduced tamoxifen, which was the first targeted therapy and adjuvant therapy of breast cancer. Tamoxifen has saved more lives from breast cancer than everything else put together. He did that. He also established the equivalence of doing chemotherapy before surgery compared to after surgery. There's not a downtime to doing that. Plus, you can see what your treatment is doing to the tumor and the patient and the individual patient, not just statistically in groups of thousands of people. You can see what's happening in that person. So, I mean, but the most important thing that Dr. Fisher did, before anybody else really took this to the scale that he did, is he took clinical research out of the area of individual institutions, going back and digging through their charts and reporting single institution experience. And he established the idea of statistically valid, multi-institutional, large, randomized trials to test the hypothesis. And that changed not only breast cancer, not only oncology, but all of medicine, cardiology, and everything. And he was one of the main people who was the advocate of that approach back in the 1950s.